All right. Hello, everyone, and welcome to our last session of the day for Within Summit. We are so glad that you're here and joining us. Before we get started, I just want to make a quick note that we are recording this session. We are recording live, so if you want to go back and watch, you are able to view it in your attendee dashboard. And I also want to remind everybody that if they have any questions during the session, you are able to ask those using the Q&A feature. So please drop in questions at any time. I would love to introduce our moderator and panelists today. Today, our moderator is Chevese Turner. With over 20 years of experience, Chevese is an internationally recognized activist and advocate, speaker, policy influencer, and movement builder who dedicates her ability to make significant social change on issues concerning eating disorders, weight stigma and discrimination, and intersectional, social justice. Chevese founded the Binge Eating Disorder Association in 2008 and successfully merged it with the National Eating Disorders Association in 2018. After 10 years, that significantly changed the eating disorders community in both scope and focus. And Chevese is currently the CEO of the Body Equity Alliance. And today we are joined by our incredible panelists. We have Sarah Bromma. She is the head of policy at Pinterest. And her team cultivates a safe and inclusive environment for pinners by developing policies that outline what is and isn't allowed on Pinterest across all types of content and advertising. Sarah, thank you so much for joining us today. We are also joined by Shilpa Vadodaria. She is the worldwide lead of digital innovation at AWS, and she leads innovation for health justice and digital equity on behalf of Amazon Web Services. She also serves as global president of two employee groups, Body Liberators at Amazon and Women in Healthcare at Amazon. Her work is predicated upon questioning the status quo in order to build a just future. Shilpa spent the last 2 decades driving national reform in the United States. She implemented the Affordable Care Act and the $40 billion Medicaid redesign with federal and state agencies. She came to this work with global experience tackling the spread of HIV and STIs in South Asia and building sanitation systems in Ghana with Engineers Without Borders. Shilpa holds an MBA from UC Berkeley Haas School of Business and a BS in biomedical engineering from Columbia University. Shilpa, welcome. Thank you for joining us at Within Summit. And we are also joined by Alice Warren-Gregory. Alice is Within Health's General Counsel, and she oversees Within's legal affairs, including corporate governance and corporate and regulatory compliance. Alice, thank you so much for being here.
Thank you, Kath, and welcome everyone. As you can tell, we have an esteemed panel of some really great, bright women here, and I'm thrilled to be moderating this discussion. The discussion was conceived as a policy discussion, meaning internal policies to companies and also policies that companies work with in terms of creating, a health justice frame and also legal aspects of a company's approach to employees and so forth. So all of our panel members have a little bit of a different point of view, but I think that's going to add to the richness of the talk today. So let's get started. And the first question that I would like to ask you all is, how can policy changes benefit mental health in the roles that you play in your companies? Sarah, do you want to kick things off with that question?
Sure. Thanks so much, Chevese. So as mentioned in the opening, I lead the policy team at Pinterest. And so the way I guess we kind of think about this is, how can we implement policies to keep Pinterest the safe, positive, and inclusive space that we want it to be, And if you're not familiar, our mission is to bring everyone inspiration, right? So we really want to cultivate a safe and welcoming and inclusive environment. And that doesn't happen just by accident, right? We have to make really deliberate decisions to try to make the platform that way for our users. And emotional and mental well-being is really top of mind for us. If our mission is to bring everyone inspiration, it's really hard to feel inspired to go take action in your life if you're feeling challenged, if you have challenges in your life, particularly around emotional and mental well-being. So this is really top of mind to us. We think about the emotional and mental well-being of our users, who we call pinners, when we're making policy decisions. And I think there's never been a more critical time in the industry around platforms, social media, to focus on mental health and well-being, right? We know people spend a very large percentage of their waking time online, and we really want to be thoughtful about the impact that time has on them. At Pinterest, we've been trying to consistently make policy changes that sometimes are outleading the industry around creating a safe and inspiring environment. And so we really try to not just keep the bad content out, so take down content that might be harmful, or hate speech, harmful content, that type of thing, but also try to bring the good in, designing the good into the product. So taking information and research and feedback we get from experts, building it into our policies, and also sharing it with our teams that are actually building the product itself. And so we can design those good experiences in. We can take users' emotional and mental well-being in consideration when we're actually building and designing how they can interact on the platform, what features should we build for them, things like that. And so it really does have an impact, right? You can, if platforms are making those deliberate decisions, it can have one type of experience for their users. If they're not thinking about that, you can kind of see where that leads, the experience for users on that platform. It goes in a very different direction. So you really can build that impact into your, I think about it like into your platform, if you're taking those things top of mind in all aspects of policy, product development, and things like that. So that's how we think about it a little bit. We'd love to hear from the other panelists as well.
Great, thank you. I was going to pivot to Alice, but I think she's having a little bit of trouble with her internet. So Shilpa, I'm going to put it to you, and I know this may be a little bit different vantage point for you.
Yeah. First of all, thanks for having me. And yeah, so a little bit of a different vantage point in that I lead innovation efforts, so external facing for Amazon Web Services, and then specifically focusing on health equity and digital equity. But the piece is like an employee of Amazon, right? That we've been able to see a lot of intention around, right? Along with a lot of other companies, is that not just sort of reverting to a way of work, right? Now that companies are trying to determine what work looks like, right? Coming into sort of 2022, what does potentially post-pandemic look like for different employees in different places? One really meaningful piece that that has come out even of our work in the last year has been, so you may have heard of leadership principles at Amazon. They're basically our, culture tenets, right? And our most sort of well-known one, and our first one, is customer obsession, right? So always having that singular focus and intention. We added actually a 16th leadership principle, which has been fantastic, which is success and scale bring broad responsibility. And even a portion of that, so as you can imagine, my work obviously even directly ties into that, even as it applies, externally to customers. But there's also a component of that is almost the sort of other side of the coin of that customer obsession in terms of employee obsession, right? So that's been really great. And there's been an openness to collaborating even with our employee resource groups in terms of understanding policies and what that could look like, going forward. And we've also seen a lot in terms of our customers wanting meaningful content and meaningful engagement from us, and even ways to innovate using our technology, in particular around topics, not just employee mental health, but actually student mental health has been a really, really predominant concern for a lot of not just digital platforms, but even higher ed institutions, state and local governments, because it's a pressing concern, right? And it's really an escalated issue. So a lot of those topics, I think, are really coinciding in this time and in this year. And there's been great intention both from, public sector, but also from private organizations to collaborate to find solutions.
So Shilpa, could you drill down a little bit and tell those of us who are not at the forefront of the type of business that you do and the others here, and what does this mean for a client of Amazon's that is in the business of eating disorders? What is the how is Amazon, those principles, the guidance that you're using, how does that play out?
Yeah. So specific to the eating disorder community, or even folks broader, who are involved in anti-sizeism, right? And really sort of stemming the spread of fat phobia and fat missia, right? So our company, being headquartered out of Seattle, has a employee resource group, so a global stretching affinity group that is focused actually on these topics. So our mission is to make Amazon an inclusive place for employees and customers of all shapes and sizes and in all bodies. So the intention there is, as you picked up, Chevese, is not just to be internal facing, right? But to also, like, how can we influence even products and services, right? External facing, so that the inclusion extends to our customers. And again, that ties into our leadership principles as well, in terms of, having our work always be a priori in terms of customers. And those are customers both on, from a cloud side, or those even using our retail, our retail offering. So the intention is to extend to inclusion for customers in all bodies across the spectrum that Amazon operates, right? So it starts with making ways in which we can make headway with product teams internally, and even with our benefits teams, right? And then beyond that, just even evangelizing around that these concepts exist, right? Even Amazon's sort of support and approval of us as an officially recognized global affinity group, right, is pretty at the forefront as far as, big companies go, big technology goes. So that even provides just, the validation and support that there is discrimination based on, body size and weight and height, and that it does require focus.
That's great. Thank you. And Alice, given that Within Health is a mental health company, and along those same lines, if you can answer, how is Within Health also promoting those policies of inclusion in this area and beyond?
Thank you so much. Yeah, so I think it's very interesting, obviously, having a company that is chock full of mental health professionals who are very attentive to these types of issues, mindful about them, thoughtful about them. As a young company, we don't have many sort of formal programs or policies at this time. However, we spend a lot of time and energy thinking about how can we support each other? How can we make sure that folks who are in management positions, even though they are mental health professionals, they may not necessarily be attuned to thinking about their role as a manager in looking for mental health issues with their employees that they supervise. So we spend a lot of time thinking about how do we train these folks who have lots of experience and understanding about how to issue spot. How do we teach them how to apply that in their role as managers? Because it's not exactly the same as being someone's personal therapist, right? You need to be mindful about the fact that there is a professional relationship, that especially in a company full of mental health care professionals, folks are going to be very sensitive about having their own issues because they're supposed to be the caretakers. And so there's some hesitancy there to allow themselves to be taken care of. And these are also issues that we as a company have had many sort of company-wide conversations about. We have a lot of we have so much expertise within our company, we make it a point to have folks present that expertise company-wide. And I've benefited so much from that because, I don't come from a mental health care background. I'm an attorney. I was in private practice for, over a decade before I joined this company. But because our sessions are company-wide, we are all educated about things like health at every size and taking care of caretakers. These types of issues are raised to the entire company receives education about them. And I think we will certainly, as we grow, sort of formalize these programs, but I'm very proud of the work we've been able to do, just given how young we are and sort of how quickly we've grown. Again, certainly that's a result of the fact that we are a company of mental health care professionals who are very attuned to these issues. But I've personally benefited greatly from sort of seeing what an environment of compassion, care, sensitivity can look like, not just patient facing, but also internally to the employees and staff.
Yeah, that's great. Thank you. And Sarah, really the same sort of question to you in terms of, Pinterest creating that safety for the outward facing, but also, inward. I assume if you're making a policy that's going to protect, your customers who are outward facing or you're outward facing toward, that you're also looking inward and how employees are treated.
Yes, I mean, for sure. I think in particular, the group that I sit in, the policy team, sits alongside our trust and safety team. And those teams in particular are often exposed to harmful content, right? They're the ones actually taking that content down. And so we really have to be top of mind. It has to be top of mind to think about their wellness and well-being. And how do we do this work in a safe and compassionate way, not just for our pinners, but for our employees. And so that work is very top of mind for the group that I'm part of, as well as for our benefits group and for our HR group. I don't want to speak for them, but we definitely want to be best in class in how we support our employees. How do we support the contract employees that we work with? How do we support our creators that are creating content on Pinterest? Because we know the creator community has faced high levels of burnout and different challenges that come with being vulnerable online. And so actually just recently, last week, I think, Pinterest announced that we're partnering with Headspace to give access to Headspace to our creators. Just being thoughtful about the different impacts our work have on our pinners, on our employees, on the creators that are creating content, and trying to take a more holistic look of what wellness and mental and emotional well-being mean, right? It can mean different things to different people. Different people are impacted by this. And I think being mindful that just because you might not be impacted by one thing, it doesn't mean other people aren't, and you should really be thoughtful and mindful. And similarly to what others mentioned, how do you train managers to issue spot? What are the resources managers have? How can you direct your employees to those? How do you show up for your teams as well? Trying to be more open about, I had to take a mental health break. I participated in this panel, and in a way that makes sure that your employees feel like it's accepted and it's expected that you take advantage of these resources. So that's very top of mind for us, particularly being in a unit where people are exposed to more harmful content. We can't always turn away from the news or an issue that might be difficult, because that is our jobs, is to keep that from being, to keep others from seeing it. That means someone has to be working on that content. So trying to develop teams that are really respectful and safe spaces and can share when maybe I can't work on that right now, and they feel confident that their teammates can take over. Again, that best in class resources are provided to them, and that any outside companies that we work with, that's very top of mind too, really making sure that they have a good wellness program for their employees. And so that those benefits extend to everybody. So those are some of the things that we keep in mind. Again, and I think the most recent update we had was just around announcing Headspace for our creators. I think it's going to invite hundreds of thousands of people to be eligible to receive free subscriptions for 6 months to this service, which we're really excited to be able to announce.
Yeah, that's great. That's great. Sarah, I'm going to stay with you and ask you to talk just a little bit about the important policy change at Pinterest that banned weight loss ads from the platform. Can you share a little more about the impact of the policy change and how you were able to implement it?
Yeah, sure. So that policy change, for those who aren't familiar, we made last summer, so July of 2021. It went into effect globally for everywhere that Pinterest runs ads. And the policy is that we don't allow any ads with weight loss language or imagery on the ad. So in the actual pin on Pinterest, the description and the landing page. So the website that the ad takes you to. And the kind of, I guess, the inspiration for the policy change was multifold, right? We're always trying to engage with experts to learn what's going on out in the fields. We can't be experts on all the potential issues that our team touches on. So we try to engage with experts to learn about best practices and trends. We try to keep our eye out for trend spotting and new research that might impact our work. And we knew from all of that engagement that struggles relating to eating disorders and body image had only increased during COVID. And from what we saw, really steep rise in unhealthy eating habits and eating disorders, particularly in young people, but in lots of people, and anxiety about coming back out after being in lockdown. And so that kind of coalesced lots of different efforts at a time we felt it was really important to make this change. We, of course, listened to our pinners and feedback from them too about the impact of these types of ads. And again, listening to experts in the field about the impact of kind of diet culture on different communities. And we know a lot of people come to Pinterest to find inspiration on living healthy lives. And so thinking about the message that, sharing weight loss ads with them is going to send at that time. So that was kind of the goal behind the policy, was really to inspire people to live a life they love, right? It's hard to do that when you're being sent these messages that you're not enough, or you need to lose weight, or, feeling shamed in some way. And so we updated that policy last July. It took us a long time to get there. We really wanted to make sure it was scalable for our company, that it made sense for the business, that we were doing the best thing we could to support our pinners. And so, that we're very proud of the announcement and the change. And it was not just kind of a one-off thing. We had actually long had policies in place that prohibited things like body shaming in ads. And that's not just around weight loss ads. You can imagine makeup ads or other types of ads might have some kind of element of body shaming in them. And we had long prohibited things like dangerous weight loss claims and dangerous weight loss products. And so the policy had kind of over the years gotten tighter and tighter. And then this felt like the natural next step and at the right time for us to make that change. And our hope is really, again, to continue to build these deliberate decisions into our product and into our policies to try to cultivate that safe and inclusive space. We want everyone to feel welcome on Pinterest, regardless of your body shape or size. And this is one way we felt we could really put the emotional and mental well-being of our users top of mind. And we've seen positive results since the policy launched. We're always looking for better ways to measure success of policies, but on this one, we did see a kind of an outpouring of support on social media from different groups that we work with, from users writing in and saying thank you for doing this and hoping other platforms are going to follow suit. We also just this past about a year after the policy launched, we went and tried to do some data analysis on, hey, how have users actually changed their behavior online? Is there any correlation to the policy? And well, it's hard to pick one thing, it was all about this or it was all about that. We did see that global searches using the term weight loss decreased 20% from when we launched the policy to about a year later. We see pinners still looking to Pinterest to discover ideas on healthy habits, healthy diets, things like that, but less focus on weight loss in particular. And so we also don't see this as kind of, again, a one-off decision. It is part of our overall effort to build a healthy and safe and inclusive space online. And so, eliminating these types of ads is one important step. It is not the only step. We know that it's not kind of the end of this conversation or the end of our work. And we are trying to take other steps to tackle eating disorder content online. On Pinterest, we block results related to eating disorders and share resources where people can get help from leading eating disorder communities or help groups. We also are trying to build more inclusivity into our product, so people don't always just see one type of body online when they're looking at something, and looking for other ways to share resources, amplify important public health information around doing things around Mental Health Awareness Month, Body Acceptance Week, National Eating Disorder Awareness Week, to really try to amplify those messages and share resources with pinners where we can. So again, not just taking down the bad content, but really trying to design the good into the product. So yeah, our teams are continuing to work on this and looking for ways we can continue to strengthen our policies and the way we build some of these ideas into the product itself. But that was specifically kind of a deep dive into that specific policy announcement.
Yes, and I said to you back channel that I as a person, as an individual who is higher weight and has had a long history with an eating disorder, it makes me very happy to see this happening, and I know it does for many others as well. Shilpa, what do you think about the future, where we go from here, how this becomes the norm in companies to really, you know, be looking at these kind of policies, and you know, what is the work that we need to do? There are a bunch of us who are expert in this area and know it inside out, and what do we need to do to get other companies, not just social media companies, but others, including mental health companies, to really understand that this is just one intersection of places where people are harmed by products and social media and so forth.
Yeah, absolutely. Thanks, Chevese. And you and I have riffed just through, you know, even the work and the conversations that we, you know, have offline. But there are so many threads to pull here, right? So I'll mention a few. You know, our founder for our affinity group, right, at Amazon, started the group around body positivity and body liberation because she was encountering diets conversations around the water cooler, basically during lunchtime, and was in recovery for an eating disorder, and now actually has also progressed to being a coach, you know, for others who are in recovery, but really then was feeling like her recovery was getting impinged upon and was potentially at risk, right? And so wanted a knowable, safe space within a work context to be protected from those types of conversations, right? We've also seen that they're coming out of 2020. I mean, you and I know a lot of the intersections, in particular, even the origin of a lot of anti-fatness is actually from anti-Blackness, and even coming out of the Atlantic slave trade. And that's where even BMI was first operationalized. So understanding the historical, sociological context is really meaningful. But then knowing that, in particular, coming out of the level of societal and organizational awareness that an uptake that there was out of the Breonna Taylor and George Floyd murders in 2020, that then how do we meaningfully and intentionally intersect our work around anti-sizeism with necessary work around reform related to anti-Blackness that still exists, right? And like, you know, anti-racism work requires anti-sizeism and vice versa, right? So that's another piece that we really meaningfully plugged into. And then, you know, there are many other threads also that then beyond folks who specifically either identify as, you know, within the eating disorder community, or, you know, the intersections as they relate to other elements of identity, right? There's also just the lived experience of most humans. We're seeing so much in this virtual environment, how we actually ran a study internally just on the frequency of folks who, in particular, are women who comment, "I'm not camera ready today," or are not comfortable sort of coming on camera, even within, you know, an internal meeting. And again, what pressures and what underlays that, and how do you create a safe space so there isn't that pressure, right, to have to join on camera, but also then what systemically is underlying that, right? Where that pressure is felt, and you can see the distinction between folks who you know, identify as women being the ones who feel the majority of that pressure, right? So there's a lot of different threads to pull, and there's a lot of different ways to start. But I think even just the intention and underlyingness of even the work that you've done, Chevese, in terms of getting binge eating recognized, right, in DSM, and having that awareness that sizeism doesn't just affect folks who look a certain way, and it isn't just a certain individual's problem or a certain section of society. all of us have had different elements of basically beliefs about our bodies and what is right or wrong about our bodies, or what is right or wrong about how we eat. We've internalized those. And there's no human on the planet who doesn't have some sort of tie in then from those beliefs to some sort of anxiety or mental health experience, right? So understanding how pervasive that is and how systemic means that I think there's really no option except for targeting systemic solutions versus individualistic solutions.
Yes, definitely. And yes, we've had many of those conversations, and this is something we could go on and on for hours about. But Alice, can you share any examples of how you've you said that I understand the company is young and so forth, and I know that Wendy Oliver Pyatt is an incredible, she's a dear friend of mine, and in fact during our time when she was at BETA on the board, it was her idea to start Weight Stigma Awareness Week, which we did back in 2011, and that was extremely successful for many years. And so maybe if you could just, I think Wendy's vision for within health is just really unique, and I know her story, and I know her journey and how she's gotten to this place where she's created a really, really different model of providing mental health services in general, but specifically eating disorder services. And so, what is the feel of the company? What is the takeaway that people should really understand? And for people to know that they're safe in this, with this company.
So yes, Wendy is an amazing person, and we are so fortunate to have her as our co-founder. And of course, everything that she is and everything that she does impacts the company and kind of sets the tone for the company. But again, as I mentioned, there are, so many incredible mental health professionals who are part of this team. And I think all of us company-wide, but specifically, of course, the mental health professionals who work for us, treatment is patient by patient, right? But I think we all understand sizeism, fat phobia, diet culture. It's the air that we all breathe, right? It's everywhere. And as we've discussed on this call, and it is our job not just to help patients with their discrete issue that they're facing and help them overcome that. It is also our job as a company to have as much impact as we possibly can on those larger societal issues, on issues like uses of products that are harmful. Recently there was an article in the Wall Street Journal that we contributed to about TikTok and how they were trying to combat, searches for eating disorders and eating disorder content on the app. But of course, the users of TikTok are very savvy. The content creators on TikTok are very savvy. And so they were finding ways around sort of the terms that were prohibited, and the kind of tools that TikTok was using to sort of combat this issue were not really as effective as maybe we hoped that they would be. I don't know that that type of sort of advocacy and activism is common, particularly for a company, again, as young as ours, as relatively small as ours, to spend our resources, which of course are so, important, right? Critical at this juncture for us as a company, on things like that. But I think we all recognize it's not a nice to have, it's a have to have. If we're not out there doing that work, we can't properly help our patients. And, if they see that we are doing that, they'll understand this is not just about building a business, right? This is not just about creating revenue. This is really about affecting change on a society-wide basis, right? I mean, our job is not done until we don't have any patients left, right? That's the dream. So, I think it's very unique to work at a company that sees its role that kind of broadly and widely, completely consistent with everything that Wendy Oliver Pyatt has done, of course. But, it's just such a rare set of circumstances that we find ourselves in. And I feel, and I think this is, again, kind of a company-wide sentiment, that it is a critical part of all of our jobs to do that work, and not just sort of larger scale work like the article in the Wall Street Journal, but also all of us personally having those difficult conversations. And this goes also to anti-racism work, right? The work that we all need to do as individuals within our spheres of influence, right? Again, diet culture is everywhere. It's very difficult to go to any event or interact with anyone, even your family members, without sometimes specifically your family members, without these types of issues coming up. And it's our job as individuals who work at this company and advocate around these issues to have those difficult conversations, to talk about why it's harmful, to talk about calorie counts in Thanksgiving dinner, or any number of these types of issues that come up. And we are trying to educate, again, fortunate to be a company of mental health professionals who are extremely well educated about these issues, but not everyone comes from that space, myself included. And so we are taking the time and energy to educate our staff as to how to have those types of conversations as well, that really have very meaningful impact. They seem small, but they're critical, as I think we all know. So it's it's definitely a unique position that we find ourselves in as such a small company, but we are trying to have an outsized impact. And I think we're well on our way.
That's great. Yes. As a person who, works with companies and gives talks about these topics, I have a lot of ideas about how things can change with regard to, cultural, the cultures within companies. And of course, that change is slow and so forth. But I'm wondering, Sarah, if you have any suggestions for folks who are in similar positions to you, or really any other position. How can they get started? I mean, every company is going to be different. But what are some suggestions, some things that you saw that worked with Pinterest?
Yeah, I think what's important, at least in the positions that we've taken, so some of the bolder policy moves that we've taken are not always easy to take. And I think recognizing that, right, it's not super easy to make a big, bold change, especially if you're the first company doing something, or whether it's an external decision or an internal decision. And that can make people a little uneasy, and that's just the way it is. I mean, and I think things that have been helpful for us is really connecting what you're trying to achieve back to the core mission or values of your company. So if you're, Shilpa, I think you mentioned this too, connecting it back to the leadership principles of Amazon, right? And for us, everything gets connected back to the company's mission of inspiration. Our mission is to bring everyone the inspiration to create a life they love, and Pinterest takes that very seriously. That is the core tenet of the company. And one of our core values is to put pinners first. Our users are our pinners. We have a lot of pin puns at Pinterest. So if we want to put our pinners first and help them find inspiration, what does that mean we need to do, right? And when you talk about it that way, it's a little bit easier to connect the dots to a big policy change you might want to make, or a feature you might want to build for your pinners, because it's not easy to be inspired if you are not feeling safe, right? If you're not feeling included on the platform, if you are not seeing people who look like you, or if you're being bombarded by messages saying, you should feel shame, or you're not good enough, or you need to do X, Y, and Z. So if you think about it that way, it's a little easier to talk about why you need to make these changes. And then, talk to lots of experts. We don't really make these changes at all without getting feedback, right? We got lots of feedback. And the feedback's not always consistent. So you talk to different experts, they might tell you to do something different, right? They might tell you, you should do this, or you should do that, or sometimes that feedback is at cross purposes. So we always try to go out and get as much feedback as we can, listen to the best research, the best practices, see where the trends are going, and then figure out how to take that into consideration for what makes the most sense to us. It might not always be a super clear. Like I said, the feedback doesn't always go always in the same direction, but you can take all that feedback, connect it to your mission, and then see, what steps you think you can take. And having data is helpful, data of impact it might have, both positive and negative. I don't think it helps to cover up what the impact, for revenue or other things, for, how much might this thing cost the company that you're trying to build, because it's better to know that than not know that. And think about the challenges that might come up, or the questions people might have, and figure out how you can best address those or best mitigate them. And look for people who want to help. I mean, I think, Shilpa, I guess you also mentioned about the ERGs, right? There's a lot of people in your company who might want to help with a project. There are people who might feel really passionate about the issue, even if they might not be on your team or on a team you would normally look to, often on issues around mental health or body image, mental health, things like that. There's going to be other people at your company who might be interested in trying to help, and they could be really good allies for you as well in building out, just gathering resources, helping with a project. So yeah, I think going back to connecting it to the company's mission or core values is really important. Thinking about the impact either on your employees or your customers, trying to hear from them, trying to gather the best research you can, figure out, again, what the impact might be on the company's bottom line, and then launch and see where you're willing to compromise. If it's the time, like, oh, don't do it now, but you can, next year we can launch this thing. Are you willing to do that? Or you really want to push, and where are you kind of willing to give and take? But what is the core thing you're trying to do? And don't lose sight of that, I think is the, some of the things that have been helpful for us. And sometimes, you just have to be willing to go first, too.
Shilpa, same question for you. And I know a little bit of the history there, but I'd love to hear a little more about, really how you've pushed from the inside, and any suggestions for others.
So, yeah, I mean, I was sharing actually with you all when we were just, prepping internally before, that actually the reason that we also have been able to swiftly, get recognition and be able to also have the traction as a global affinity group is because there are a degree of protections in Washington state against discrimination in a workplace based on your body size, weight and height. And so based on that, then it allows also, again, legitimacy, right? And validity. And so those systemic grounds and having that from, whether it's from a legal standpoint or policy within a company, right? Or even just sort of the groundswell of a group of employees coming together. Our size right now of our employee group, and we're just, 2 years in, is about 5,000 employees who are sort of regularly part, of our group. And that obviously our community, especially for our intersectional events, extends beyond that, right? So the alignment around values, right, and having sort of shared tenets, I think is really important. The other key piece that we sort of to quickly mature from JV to varsity, right, that in addition to Sarah's comments that I'll add, is creating a safe space, I think, is table stakes, right, as sort of version 1. And so in whatever work that, we're all doing, and Alice, I know you're nodding because that's table stakes for any mental health, right, conversation. So that definitely is version 1, but finding a meaningful and sort of not overwhelming way for your version 2 of whatever efforts, are being undertaken while maintaining a safe space, then add a brave space, right? Which is that space where folks can then, who will not be triggered and sort of, are only going to have the option and need to stay within the safe space. But for those who want to learn, or for those who are learned themselves and are willing to help, educate and push others, to then have that space where you can make mistakes, you can ask questions, you need to learn, and it's not with an environment of calling out, right? The intention is around calling in. And so there's a lot of protections, and we have a lot of moderation internally around how we work to keep that brave space really healthy and productive, as well. But then being able to meaningfully maintain both of those conversations, I think has been really impactful for us in the last 2 years.
That's great. Thank you. And Alice, again, I know that it's, a young company, but any advice that, I know what it's like to build a company or an organization and being there on the ground floor. So any learning that you've had thus far that could be helpful?
Yeah, I mean, I think, one of the benefits of being at a small company that is so kind of close knit, even as we've grown rapidly, is that we are able to have those conversations, asking questions, making mistakes. And there's an understanding and a compassion for each other, that we're all growing together as a company, as people, as professionals. I love this idea of sort of a brave space, not just a safe space. And I think, again, one of the benefits of being a kind of a younger company, a technology company, a company that is sort of breaking ground in lots of different areas, is that as a culture, we also kind of feel safe to break ground, and try new things and fall on our faces sometimes, and that's okay. And we'll be there to pick each other up. But we know that we're not going to be able to do anything meaningful. We're not going to be able to have the impact that we want to have. And we're not going to be able to build the team and the culture that we want to build if we're not willing to make those mistakes, because we are trying to do something different, right? We're not just looking at a playbook that someone else wrote, and following the steps. That won't work for us, because we're doing something that's completely new. And so we have to be willing to make mistakes. We have to be willing to be wrong. And as an attorney, coming from law firms, I'm not familiar with a culture where people are willing to be wrong. So this is new for me. And I love it. I'm so appreciative of it. It gives people the ability to really learn, when it stops being about being right and starts being about learning. Right. And all of us having a better understanding and being more compassionate and having more context for the work that we're doing. That's where I think, you really start to make a difference. You really start to create something new and different, that is what we need right now as a society, as companies, as a society, as a people. I think if we learned anything during the pandemic, it's that the old way wasn't really working for most people, right? And that wasn't necessarily visible. It became visible. And so we don't really have a choice now. We have to do things differently. We have to be willing to break things, and in the most kind, compassionate, caring, safe way, that doesn't make people feel like they're going to be collateral damage. And so, how translatable is that to companies that are a little bit more established or larger, have a little bit more infrastructure or bureaucracy? I think it is possible to kind of take that attitude with you even into those environments. You have to have some allies. You can't do it yourself. But I do think we're kind of all at the point where we're ready for change. We recognize that it's not optional, it's necessary now. And again, we are so fortunate to be in a position where we're kind of in the business of breaking things right now and creating something entirely new. But I do think that combination of safety and bravery that Shilpa raised is so critical. And that was a great piece of wisdom for me. So I'm thank you for sharing that with us. I think it's really translatable to all of our positions and contexts.
Yeah, I think we all want to see companies be authentic and vulnerable and transparent, and that's going to lead to a lot more trust in whatever they're doing. So that definitely is a mold to be broken, because we don't always think of those qualities being quote unquote professional, and in fact they are. they're at the top of the list. So I am going to open it up now. We have about 12-13 minutes to questions. And so if there is anybody who has a burning question that they would like to ask one of our panel members, please do. We do have just a comment from Wendy, and she says, we're fortunate to have legal counsel, meaning Alice, who is so connected with our values, and it's wonderful to have Chevese involved to help us rally and stay focused on our mission. Love all of you are doing. Thank you. Love concept of safe and brave space. So yeah, that's something that I know that within health is, it's at the core. So thank you for that, Wendy. And I'll move on and ask the panel just another question or so as we wait to see if there's any further comments. So at the end of the day, when you are creating safety and security and inclusivity, I know that, I've been working with a company who is putting together a rather large campaign that is going to really try to tackle the intersection of racism and weightism. And the teams have really had a difficult time, not a difficult time, but they have taken a lot of time to explain these concepts of weightism, fatism, size, inclusivity, and so forth. And so I'm wondering, Sarah, from your perspective in a big company, what is it like trying to tie, the harm of eating disorders? And I think people sometimes even though they don't understand eating disorders well, sometimes understand that better than they understand the harm of weight stigma and discrimination and so forth. And so we know in big companies, these policies don't just happen from a small group of people. There has to be buy-in from across teams, and I'm sure in some hierarchies and that sort of thing. So how difficult was that to work with at Pinterest?
Yeah, I mean, I think, I think there are some people who understand right away. I mean, kind of getting back to some of the earlier questions, right? Not everyone's going to have personal experience with this. And I think if you don't have personal experience with it, or you feel like it doesn't affect you that much, it's harder to understand. And so I think, again, getting back to what I mentioned earlier about some advice on how to do this, that's really what we did, right? We had ideas about what we wanted to do and been kind of percolating for a while. But in engaging with experts, I think we are really focused on tackling harm on the platform. And so thinking about how this is causing harm, kind of getting to your question, was really important for us. And so in talking with experts and looking at the research around the steep rise in disordered eating since the start of COVID. I mean, we did this in the summer of 2021. So we were working on it basically the second half of 2020 when we were all barely leaving our house probably, and in the first half of 2021. So we were deep in that. And people were looking to, maybe lockdowns lifting and coming out of the house and the anxiety that came around that. So it was at a very particular time where all of this kind of coalesced for us. And the research on, the impact of diet culture, the impact of eating disorders was pretty clear. And so trying to again, focus on that, like how does this ladder up to our policy approach? And we don't, we see that Pinterest is not a place for harmful content. And so thinking about, and then differentiating how we think about content on the platform, right? So it is one thing to say, we won't allow anyone to look up anything about weight loss on Pinterest overall. That's a little bit different. What we were focused on is saying, what are some places we could start with? And ads to us, we always have stricter approaches to the ads we allow because ads get pushed out to people, right? We're sending you this ad, and it doesn't necessarily mean that you've told us you want to see it. And so that's a place where we really try to be very careful. And so looking at the harm that we have learned about eating disorders and feedback from pinners about how they feel about these types of ads, and then looking at our policy approach. And the place that we felt it made most sense to start with was with advertising, because again, people aren't necessarily saying that they're interested in this content, but we're, potentially sending it to them. It could be potentially very triggering. So I think that was the way that we approached it. We didn't come in and say, we're going to go to like there's different ways you could approach this basically. And we felt what we made was a really reasonable approach that addressed the harm that we were focused on, was backed up by experts. Again, we might not have been able to do everything they wanted us to do, but we really listened and tried to make it make sense for our platform. And then explain to people why we were doing it, what the impact was going to be, and that we were willing to partner on, making sure our, advertising partners knew this was coming. It was not going to be a surprise to them because that's not very fair either. And that, we let them know, we listened to their concerns as well, and ultimately set a date and said, we're going to launch it. And we had a lot of support from our leadership, again, because it made sense to connect it to our mission. It made sense to focus on this type of harm. And so we didn't have actually a lot of pushback. I mean, I'm sure not everyone was super happy, but I think overall employees really appreciated what we were doing, and the support from the, you know, external community, from pinners and others, was really overwhelming. So I think, you know, it made employees feel good that we were willing to take a stand. And that's always important too. If you're willing to do something for your customers, it has impact on your employees too, both ways, right? I mean, employees can get, you know, feel the impact of those decisions, even though it wasn't directed at them. So yeah, I think all of that helped us in this case. And yeah, and hopefully that helps other platforms again, because they don't have to be the first to do it. Hopefully it gives them some, you know, cover to take a risk like that.
And I just want to, Shivese,
go ahead.
Just
go ahead.
one comment.
Yeah.
To expand on that in terms of, you know, another part of the stem of your question, right, was around where we've all experienced that the acceptance, or even just willingness to be aware and accept organizationally and systemically of triggering eating disorders is higher than weight stigma writ large, is also because of even some of that internalized fat phobia within those systems, right? In terms of a willingness to prioritize even the research, right, to produce data and evidence around what traditionally was understood as eating disorders space, right, in terms of anorexia, bulimia, and how they are affecting sort of smaller fat or thin presenting folks, right, in the way that we traditionally understood it. Whereas weight stigma writ large still runs into people's like personal stories about what my body should look like, or what is right in terms of what I eat, or how I, you know, am and move and whatnot. And so even as individuals or companies, and then even, you know, where we can put some of our dollars or some of our support vocally, putting that behind even some of the research, so we get more of the evidence and the data that we can point to as it relates to body discrimination and weight stigma writ large. I know even in terms of the work that we're doing internally at Amazon, it's such a data and evidence focused company that having more of that will allow us to even just be more effective at influencing change, right?
Absolutely. And Shilpa, we do have one question. I was gonna send this to you. Do you have any suggestions for how to address this topic and create braver spaces in companies that are reticent to even use the word harm?
Interesting. Okay, so without, you know, knowing concept, but I think if it's a space in which you know, our recommendation from our experience in terms of a company or a group, you know, that is reticent to use the word harm even, would actually be to start with a safe space. Versus trying to sort of jump immediately, because the understanding, and again, a safe space doesn't mean the entire ecosystem, right? It's sort of the carve out of a specific section of the space and then having specific elements. Like, for example, some of our tenets that we have is there is no moralistic quality to what you choose to eat or not, right? Whether your body can move a certain way or whether it doesn't, or how you choose to move your body, there's again no moralistic attachment to that, right? Those are some of our core principles for our safe space, right? And the understanding and even utilization of some of that early evidence that even Sarah was referring to, right, as it relates to the rise of eating disorders that really, you know, accelerated during the pandemic, and what we really know is well researched in terms of trigger points, right, for a lot of that is, I think, the evidence to use to advocate for the creation of that safe space. That is the most probably effective way to then even have some identification of like potential harms or what the potential risks even are, right? For a space that is reticent to use that word. The concept of then a brave space, though, of like learning and safe to learn, safe to fail, experimenting, is probably actually just even mentally too much of a push for an immediate jump.
I 100% agree. You need to start somewhere and then move from there when the company and those in it are ready to do so. Yeah. I think that is it, Kath. And so I'm going to turn it back over to you. And thank you, everyone on the panel and everyone who attended. This was a really great conversation, and I appreciate the input.
Yeah, thank you all so much for being here today. We are just so honored that you were here to share your wisdom and your insights with us. Chevese, thank you so much for leading the conversation. We're so grateful for all of you to be here at Within Summit with us. So that ends our final session for the day. Thank you to all the attendees for showing up and tuning in. And we look forward to seeing you tomorrow at day 2. And everybody enjoy the rest of your day.
Thanks all.
Thank you.
Bye.
Bye.